Dr. Shokanzaki in Keio University advised me that today's topic dementia and hearing loss. At the time, 9 years ago, I saw some patients with dementia, but I didn't see their eardrum. After Dr. Kanzaki's advice, I found lots of patients with dementia had hearing loss, and some of them had earwax. Our psychiatric hospital is very unique. How unique? Otolaryngologic examinations were started since 1994 by 73 years old ENT doctors. Nowadays, I see the patient not only with otolaryngologic disorders but also with psychiatric disorders. Then I perform otolaryngologic exams and psychiatric exams simultaneously. My otolaryngologic exam started since 2005. I already had an otolaryngologic license, but I worked as a psychiatrist at the time. Then I got mental health designated doctor license and psychiatry license. My topic is brain and inner ear. My topic is dementia and hearing loss. About dementia, Japan elderly population is 36,400,000. This number is 29% of the total Japanese population. 50% is more than 75 years old. Hyper-aged society. Dementia patients are increasing. That's the important issue of the G8 summit. My opinion, hearing loss, vertigo patients may have developing dementia. The most common complication in dementia patients was hearing loss. Dr. Frank R. Lin reported that hearing loss is a risk of developing dementia, especially moderate hearing loss. One of the NEUROOTOLOGICAL treatment of hearing loss is hearing aid, but hearing aids ownership rate in Japan is significantly lower than in other developed countries, 14.1%. More than 65 years old, hearing aid usage 70% of hearing loss. In European country, mean hearing aid worn are 8 or 9 hours, but in Japan, 5.7 hours a day. To improve this situation, the International Symposium on Hearing Loss and Dementia Depression was held in Tokyo on 15 January 2017. I met Dr. Lin directly. We talked about the possibility of hearing aid. The subjects were 217 patients with dementia and 91 patients with mild cognitive impairment, MCI. Psychiatric exam is revised Hasegawa's dementia scale, HDSR, and otolaryngologic exam is pure tone audiometry, PTA. He is President Yoshida, second generation. He is an executive director of the Prefectural Medical Association for COVID-19. Our hospital started 50 years ago. HDSR is one of the most famous dementia tests. This patient could not answer 100 minus 7 and vegetable name. The score is 14. Then this patient has dementia. We show the various types of dementia: Alzheimer, vascular, DLB, FTD, and mixed. In my patients, 60% is Alzheimer and 8% vascular, 7% DLB, 15% FTD, and 10% mixed. We show the result of HDSR normal and mild, moderate 1, moderate 2, and severe MCI this year. We show the result of PTA. Half of dementia patients had bilateral moderate hearing loss. About 90% of dementia patients had hearing loss, and 88% of MCI patients had hearing loss. The rate of hearing aid usage in 2020 was get better 35% in dementia and 45% in MCI. That's why we encourage to wear and continue hearing aid. Hearing aid company Makichie's staff came to our hospital from Miyazaki City, 100 km, 2 hours drive. Before COVID-19 pandemic, hearing and consultation days were 6 times a month. But after COVID-19 pandemic, they could not enter our hospital for the role of infection control team, ICT. We show outside hearing aid consultation. Cicada noise was terrible. Under direct sunlight was very hot, 40 degrees Celsius. Hearing aid consultation day decreased 6 to 2 times a month. That is in May 2020. In August 2020, it was very hot to wear protective suits. In room, window fully opened. Then air conditioner was not enough. Outside was hot and terrible. There were tent installation but very hot. In December 2020, ventilation is cold. There were fan heaters but very cold. In February this year, there was a container house in front of hospital, but I have to talk to patients in a container house from outside using window. The rate of hearing aid usage in 2021 was get better, 36.5% in dementia and 46% in MCI. After pandemic, we encourage to wear and continue hearing aid. We show hearing aid company Kamakichi's data about rental and purchase hearing aid. Surprisingly, the number of patients buying hearing aid increased. Yeah, we did. We present remarkable 16 cases with HDSR score improvement. Cognitive function tend to be maintained in the last 9 cases. Good relationship and with family and going to daycare seems to be important, especially case 11. 74-year-old woman with BDRV could get perfect score of 30 points on SDSR. The rate of hearing aid usage was high, 75%. It is important for patients to detect their hearing loss and usefulness of hearing aid. We have to be careful for the possibility of pseudo dementia, cognitive dysfunction caused by hearing loss and or earwax. The rate of hearing aid usage in Japan was low, 70%, but that in this study we were not low, 36% in dementia and 46% in MCI. We also experienced an 88-year-old man in which speech discrimination score SDS was less than 50%, even though PTA on both ears were about 40 decibel. SDS less than 50% shows physically disabled 4th grade. Cognitive function tests like SDSR or MMSE includes 3 parts. 1, cognitive of the sound like PTA, cognitive of the words like SDS, and poor judgment and delusion. Psychiatrists are not familiar with hearing. Otolaryngologists should evaluate PTA and SDS we believe that mental hearing rehabilitation by hearing aid is effective to preserve their cognitive function. Conclusion: 90% patients with dementia and MCI had hearing loss. 36% of patients with dementia and 46% with MCI continue to wear hearing aid. We presented 16 cases of cognitive function improvement. Cognitive function tends to be maintained in the last 9 cases. Good relationship with family and going to daycare seems to be important. Hearing level affects cognitive function. Therefore, hearing tests are very important for elderly person to evaluate not only inner ear but also brain function. We believe that mental hearing rehabilitation with hearing aid is effective to preserve their cognitive function. Thank you very much.